so I'm about to take a pregnancy test. I haven't been feeling good lately, super dizzy. Missed my period. It was only literally like a day. My husband cooked ham and it made me so nauseous, and the smell of his cologne or aftershave made me really nauseous. I'm infertile. I've been infertile for 10 years. I take these routinely, so we'll see how it goes. We shall see. I thought I'd take you guys along on the journey because these are so depressing to all of us who are infertile. We've been trying for 10 years. It's never happened. I take these routinely because my period misses. I didn't even have a period for 8 months one time. I think at this point it's honestly just wishful thinking, and our next option is most likely adoption. So we shall see. Give it another minute, hold on. I'm trying to stop myself from crying on screen with you guys. It's always negative. I always go to the hospital, and every time I do, they're like, is there any chance you could be pregnant? And I'm like, no. I've been infertile for 10 years. Doesn't happen. And with all my health issues and going to the hospital, every time they pregnancy test me, they're like, oh, you're not pregnant. Like, you're not pregnant. And I'm like, yeah, I know. Like, trust me, I know. And so it's gotten to the point over the last 10 years where whenever my pregnancy test is negative, they literally just don't tell me anything. They just skip over it. So, I'm scared. Okay, you guys look. Do you see that? Do you see what that says? Oh my God. My hand is shaking. Hi guys, I'm back. Ended that last video, didn't continue it because I had a horrible panic attack when I saw the pregnancy test. You think that I would be super happy and it's what I've always wanted, it is what I wanted, but I was terrified after being infertile for 10 years and I didn't know what getting pregnant after that would be like. The risks that came with it, all of the above. I hadn't been feeling good that entire week, so I decided, hey, I'm just going to go to the hospital because something doesn't feel right. I don't feel good. I've been super lightheaded, super nauseous, very dizzy, haven't been able to focus, like I just haven't felt myself. And so I went to the hospital, was there for like 6 hours, and they confirmed it. I am pregnant. I did have trace amounts of bacteria in my urine, and it said it looks like the start of UTI, so they will treat it with pregnancy-safe antibiotics, but they said it's probably due to me holding my bladder, because they asked me if I hold my bladder a lot, and I said, well, yeah, because lately I feel like I have to pee like every 30 minutes, so I've been trying to hold it because feasibly I can't go to the bathroom every 30 minutes when I have things to do or I'm working, or it's just not possible. And so they're like, yeah, you're pregnant, and that's just what happens. Like, you have to urinate more, and so stop holding your pee because you're going to keep getting urinary tract infections. And I was like, okay, like, of course, I will stop because I had no idea I was pregnant. So, I'm happy that it all turned out. Funny enough, I rewatched my first video just to see what I had said in the moment because I don't really remember. It's such a blur. And I remember mentioning the hospital and how they always test me because it's like part of their preventative medicine. Like, they have to test you for pregnancy. But in the last 10 years, they just stopped telling me if I was negative because it was always so hurtful each and every time. And so This time they had sat me down in a room and they were like, well, we would like to tell you that you're pregnant. And I had my sister with me, and we were sitting there, and I was pretty much just like in shock, staring at the wall. And the poor guy who came to deliver the news, he was like, congratulations, oh my god, I'm so happy for you. And my sister said that I was just blank, like I was staring at the wall with like tears in my eyes, and all I remember is the doctor leaning over to my sister and going like, are we happy? Are we not happy? Did I upset her? We're not happy about it. And my sister started laughing, and she was like, no, 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 give her a second. She's got to come to. Like, she's been trying for kids for 10 years, but she's been infertile, and I think she's just in shock right now. And the guy was like, oh, okay, yeah, yeah. And so, like, slowly started coming out of it and asking him about my medications that I take. And I was like, is this safe? And he sat with me the whole time, looked up all my meds with me, made sure that I told him the correct doses and if they were safe or not. So we got all that sorted out. Cried a lot of tears of joy. And he congratulated me once more, and then he was like, so unfortunately, because you've been infertile for the last 10 years, we never check your HCG because you're never pregnant. It's always negative. And so we did not check your HCG this time. So if you want us to check it, you're going to have to wait here like another 3 hours. And I was like, well, no, like I'm already nauseous, don't feel good, I just want to go lay down and sleep. And he's like, that's probably best. Like, just go to your primary and ask your primary to do the HCG test because the hospital told you you're pregnant. I was like, okay, that sounds great. So that's what I did this week is I went to my doctor and they ordered a HCG qualitative is what his assistant ordered, which he messed up because he was supposed to order an HCG quantitative. So I literally have to go back tomorrow or the next day to redo the qualitative HCG to see how far along I am. I already did an ultrasound this week as well, and my bladder wasn't full enough to accurately measure, but you can... Sorry, that last one cut out. So the bladder wasn't full enough to accurately measure how far along I am. So I do have to go back and do that, but I can't get back there for another week or two. And by that time, I will already see my OBGYN, hopefully. So my OBGYN will just do it in office.